everyone. My name is Jennifer Jones. I am a nursing student at Fort Hays State University. I am taking this class to complete the rest of my credits to be able to graduate in December, so I'm very excited. Today I am going to talk about the interview that I completed a couple weeks ago. I was fortunate enough to be able to interview a registered nurse named Janie Phillips. Janie has been a registered nurse for the last 6 years at Wesley Medical Center. For the last 2 years, she's been a registered nurse in the emergency room, working on adults and kiddos on their main campus. She made the transition from being a floor nurse to an ER nurse because she really felt like she could impact a lot more lives. Caring for people, making a difference in their lives is very, very important to Janie. The ER has always been her dream. She's seen an opportunity a couple years ago and seized it. Nursing to her is very respectful and has a lot of dignity. Patients look to her as very trustworthy and a big resource for them. Some of her interactions with patients have taught her many things over the years, especially professionalism. In order to have that professional contact with patients, she believes that you need to make direct eye contact with them and standing directly in front of that patient. You need to be actively listening, repeating what they're telling you so that they know that you are interested in their story. She also believes it's very important to have the proper uniform and the proper dress. They're at Wesley, they wear maroon scrubs so that the patients can easily identify who the nurses are. It's also important to her to have a cleanliness of their facilities. She makes sure that all of her rooms are clean and ready for her patients. She also treats every patient with dignity and respect, knowing that they are there for a reason. Each one of them is a person and they should be treated accordingly. She also always has a smile on her face and tries to have a positive attitude. She knows that attitude can be infectious amongst employees. She loves where she works. Like I mentioned before, the ER has always been her dream. So she tries to give a very positive outlook to the people around her. And she loves her job. She takes great pride in her job. She likes to make a very good first impression. When she walks in a room, like I mentioned before, she's smiling, she's joyful, and that's important to her because it puts her patients at ease. She makes sure that every patient feels loved, answers all of their questions before she leaves the room. She focuses on them and takes their concerns very seriously. It really bothers her that these new nurses coming out of school are kind of lacking in that professionalism. They're on their personal phones a lot. They're chatting outside of the room with what may be inappropriate language about inappropriate subjects that happened the night before. Patients can hear everything that's going on, and it gives them a bad taste in their mouth about the employees of Wesley, and that really bothers Janie. Some of the professional groups that she is involved in are the American Nurses Association and the Emergency Nurses Association. Both of these groups provide newsletters and educational opportunities. She is able to take what she's learned from them and to pass it on to staff members and management on new cutting-edge research that pertains to anything in the ER. One of these examples would be septic research. She read an article that door to antibiotic time in the ER should be 60 minutes for septic patients, and it saves lives. So this is something that they've implemented in her department. Some of the most rewarding things about her job is improving the quality of life, making patients smile, and educating patients on their health so that they can take an active role in feeling better. Some of the challenges that she's had, of course, dealing with patient deaths would be horrible. And then addicts, drug, alcohol, refusing care, refusing treatment, refusing options that she has to offer them. Advice that she's given Anyone wanting to jump into this profession needs to do it for the right reasons. Those reasons do not include money. You need to love people and want to make a real difference in their lives. You have to be able to accept that every day will be different and not every day will be filled with joy. The sorrow that comes with my profession is part of the deal. And that was a direct quote from Janie. Again, Janie loves her job. She loves being a role model, and that's very important to her. She loves to provide excellent care and make a difference in people's lives. Janie's respectful, thoughtful, and very professional, and I would be proud to have her as a nurse for either myself or anyone in my family. Thank you.